Hello, everybody. We have one more addition to the lineup for the Airway Anatomy Forum in Santa Clara on October 24th and 25th. Dr. Bhave is a prosthodontist who is heavily involved in treating TMD. And we all know that with airway obstruction, there's muscle parafunction and all kinds of joint compression and signs, symptoms, pathology related to joint dysfunction. And we're so grateful to have Dr. Bhave speak on her protocols and treatment options for TMD. So here you go, Dr. Bhave. Thank you so much.
Thank you so much for having me. I'm so excited to be joining the AACP and presenting at this Airway Forum, which starts on October 24th in Santa Clara, California. The topic that I'll be presenting is the use of biologics and regenerative medicine in the treatment of TMD. We all know that TMD and sleep apnea have been related, and it's almost like we're treating the same patient. Untreated sleep apnea often develops joint problems, and patients have joint pain, arthritic conditions, etc. Now, the breakthrough in the treatment of TMD is the use of biologics like platelet-rich fibrin, PRF, exosomes, stem cells. And I'm super excited to share these new treatment modalities and how we can use them in the correct clinical scenarios to treat joint issues. So very excited to share that.